How are you doing today?
I'm good. How are you?
I'm good. My name is Ed. I'm going to be your nurse for today.
Okay.
Um, I know that you're just seeing your therapist
I have.
recently. Yeah, and she sent you to our facility to give you some help with what you're currently going through.
Yes.
So, can you tell me about your visit to your doctor?
So I went to my doctor and he diagnosed me with major depressive disorder. I've been feeling pretty down lately the past couple months. I just recently lost my job. So it's kind of affected my whole life. I've not really been in the mood for anything. I've been down. I've not been able to even leave my house. I've just been so depressed lately. There's just nothing that's been able to help me.
I understand. Must be very hard to lose a job,
Yes.
and I'm so sorry for it. I'm so glad that it's early on in your stage of depression that you went to see your doctor. A lot of the patients don't actually go and see a doctor because they feel ashamed of what they're going through. You
Right.
know, they're not really ready to share what they have. But I'm glad you went and see your doctor, and your doctor sent you to us to give you some help.
Okay.
Okay. Um, so I'm gonna give you some good to know information about your recent diagnosis, major depressive disorder. Um, is there any concerns about the diagnosis that you have? Can you tell me about it?
Um, I don't think so. I don't think I have any major concerns. I mean, my doctor pretty much went over it pretty well. I just kind of would like to be maybe educated a little bit more on the signs and symptoms of it and possible treatments that I could do to help me
Yeah.
better cope with this diagnosis because it's kind of a shock, for me to be diagnosed with something like this.
So you said when you lost your job, aside from being depressed, have you had other symptoms like having lack of sleep?
Yeah,
Not.
I've been sleeping maybe 2 hours a night at most. It's kind of kept me up. It's kind of taken me away from my family a little bit. Like I said, I've not really been able to leave my house or really been able to do anything and enjoy.
So this has not happened in the past. This is just recently when you lost your job. Okay. I'm just gonna have to ask you a little bit too. Have you had any thoughts about harming yourself?
No.
Oh, okay. That's good. So as you know, I'm sure the doctor already told you, but major depression is actually a medical condition where a person, just like yourself, experiences extremely low mood. Um, that sometimes it becomes a problem when it interferes your day-to-day living. You know, you're functioning. You can't go to, you know, grocery. You can't do it anymore. You can go out with your family. You can go out with your friend. You just feel low all the time. Okay, as to with the symptoms as well, there are different symptoms that includes when a patient is diagnosed with depression. A lot of the times they're in a depressed mood. They have loss of interest or pleasure in doing things. Are these the things that you feel that you've been feeling?
Yes.
There's also a possibility that there will be a change in your appetite. You're not gonna, a lot of times you don't feel like eating, or a lot of times also some of the patients would feel like this, the so-called stress eating, when they're very stressed and depressed, try to eat up to some point where they gain weight without knowing, and by the time that they get more depressed because they've gained so much weight and they don't know what to do. And a lot of times also they feel like very low energy, um, you know, very low activity level. They feel insomnia. They don't get to sleep right away. They feel worthless. Do you feel this way too?
I do.
Okay. And they feel hopeless and helpless as well.
That's pretty much all of how I feel.
Okay. You also feel guilt at some point?
I do. Now because my husband's the one who has to be the main provider of the family, so it's kind of, I feel a lot of guilt about that now because I'm not able to provide what I should be to support the family.
Okay. So you told me you have a husband. Do you also have children?
I do. I have two, a boy and a girl.
Okay. Do you feel like they're also supporting you as well with what you're going through?
I do. They've been, a big help for me. My husband's been a pretty big support as well. He's been there for me, tried to comfort me and everything. And then the kids kind of take my mind away from it a little bit, so it kind of helps a little, but it still just kind of overtakes me.
Oh, okay. I'm glad to know that you actually have a family that you can go through when you're having depression or you're having trouble. Um, I mentioned this one because it's very important. Part of the therapy is not just the medicine, but we're moving into like a holistic therapy that includes, finding your coping mechanism, finding a strong support, aside from family and friends. You're also going to be going through a lot of like group therapy sessions and one-on-one with your psychiatrist. Okay. Did you have any other questions about your diagnosis?
I don't think so. I think you pretty much covered everything that.
So, just a quick question. In your daily, day-to-day living, what are the stressors that you've been experiencing?
Um, Mainly just pretty much my job.
Okay.
I think that's the biggest stress of.
Are you worried about not being able to like provide
Yes.
financially, especially with your children?
Yes.
Are
I'm
you
worried about losing the house. I'm worried about, my husband having to take all of the load off. He's probably going to have to work more hours. I'm not going to be able to see him as often as I want to. So it's just kind of.
I'm sorry that you have to go through that. It must be very hard to go though to get through those, problem at home. Losing a job is not really easy. So much so as like thinking about the future of your children, losing a house and so on. But I'm glad that you came in here today and you came to see your doctor. So we're gonna be able to start with your therapy, and that includes your medication. You think you're gonna be open to start your therapy?
Definitely.
Okay. So like I said, I'm giving you that information. Tells you about the basic facts about major depressive disorder and how and what are the things that you can try to do to help you cope up with your situation. That
Okay.
includes family, friends, going through therapy. But the most important thing I want to tell you right now is your the medication that your doctor had prescribed to you.
Okay.
Okay, have you ever heard about the medication Elavil?
I've never heard of it.
Okay. On the last page of that paper that I give you is
Okay.
important information about your medication, the name of the medication, when to take it, what's the dose that you're going to be taking, what it is for, and what are the signs and symptoms. The side effects that you want to watch out for. Okay, so your medication is called amitriptyline. That's the generic name, but you're gonna be taking Elavil. That's the brand name.
Okay.
Okay, so your dose would be 25 milligrams tablet. This comes in a tablet form. You take a total of 75 milligrams in a day, but we divide it in three equally divided doses. So you're gonna take it in the morning, in the afternoon, and at bedtime.
Okay.
Okay. What it is for? It is for mainly to treat your depression. So over the few weeks, you would start to feel the effect of the medicine. This doesn't affect right away. It takes several weeks to take the effect, to feel the effect. And what it does is kind of just increase your mood. You don't get depressed as often as you are now. This medicine is also used to treat anxiety, insomnia, and chronic pains as well, which I'm sure this is just going to be used for your depression and your insomnia.
Right.
Okay. Most common side effects of this medicine, there's the blurred vision, dry eyes, dry mouth, and a very good way to help you with your dry mouth is to maintain a good oral hygiene. Washing your mouth and having some gums ready with you. You can chew. Would help with your dry mouth. Hypotension. This is very important. You make sure when you get up slowly. If you feel dizzy after getting up, that means you might be experiencing hypotension. So just for you not to run the risk of falling, you make sure you rise slowly from bed. Constipation, which is a common side effect of any antidepressant medicine. Your doctor might prescribe, medicine for constipation, but non-pharmacological wise, you can just increase your fiber intake and at the same time your fluid intake as well.
Okay.
Okay. Urinary retention, if you feel like you're not peeing as you're supposed to be, you could be retaining some urine, make sure you call your doctor. Okay.
Okay.
Some weight gain, like I said, you might be stress eating. So that's a common side effect. Make sure you tell your doctor about that. And some decreased sexual function, photosensitivity, and sedation. You want to make sure when you go outside when it's sunny, you put on some sunscreen and put on a long sleeve shirt so you don't react to the sun. And at the same time, very importantly, sedation. Make sure when you take this medicine, there's going to be a chance that you're going to feel drowsy, so you make sure you're not driving after taking this medicine. Very importantly, the most important thing that you have to be mindful of this medication, this can cause suicidal thoughts, especially in the early phases of your therapy. So you make sure if you feel like you started to feel or to think about, committing suicide or harming yourself, you gotta make sure you tell your doctor right away.
Okay.
Okay. And I'm sure this is not going to be a problem with you because for patients who have cardiovascular disease, their ECGs should be monitored because they could, cause some fluctuations in their heart rhythm. But I look at your chart, you don't seem like you have cardiovascular problem in
It
the past.
does.
But if you do feel like your heart rate is racing or, it's not regular than the normal you feel, make sure you call your doctor right away. Okay? And this can be taken with or without food, but you take it right away after a meal just to decrease, to reduce gastric upset.
Okay.
Okay? And most importantly, do not drink alcohol while you're in this therapy. Usually, after a couple of weeks after you're done with this therapy, you can take alcohol, but in moderation. I believe it's like a few days after that. But just a side of caution, just don't drink anything, even just a slight, drink of alcohol. It is very important that you make your follow-up regularly with your doctor, set up an appointment that you have to see him, as what he wanted you to see him regularly, and do not stop this medication without talking to your doctor because a lot of times all of these antidepressant medication, if you stop it right away without telling your doctor, a lot of the patients would experience what they call withdrawal symptoms, where they feel more depressed, anxious, and suicidal, and all those. Okay? All those side effects. Did you have any question for me?
I don't think so. I think you pretty much covered everything that I needed to have covered for me. So.
Okay. Yeah, so today's your day one. You're going to be taking your medication. Make sure you go through it. And, we look forward in, we look forward in having you getting through this situation and, you feel better and be like the normal person that you were before.
I hope so.
Okay.
I really do. I
It
hope
was
so.
it was nice meeting you.
Nice meeting you too.
This is not going to be the last time I'm going to
No,
be
I
seeing
will be
you.
back.
So you
I'll
will be
definitely
back.
Thank you for the packets.
Okay.
Information.
Okay. Thank you very much, and
Thank
you have a
so
good day.
much. You too.